Okay, let's talk about health insurance. I know, it can feel like you're trying to read a different language, right? So many confusing terms and complicated rules. But what if I told you there's a super simple way to figure out any health plan? Well, in this explainer, that's exactly what we're going to do. We're handing you the keys to unlock it all.
You hear all these words thrown around: group, private, comprehensive, and you're just like, what does any of that actually mean? If your head is spinning, trust me, you are not alone. It almost feels like the jargon is designed to be confusing. But we are about to fix that.
Look, the secret here isn't to go out and memorize a whole dictionary of insurance terms. No way. It's all about asking the right questions. We're going to give you a really simple toolkit, just 3 questions. And with these, you'll be able to understand pretty much any health plan that comes your way.
All right, ready for question number 1? This is the big one, the most fundamental question you can ask. And the answer immediately splits all health plans into 2 main buckets.
So here is the contract between you and the insurance company, or is it between your employer and the insurance company? See the difference? If it's just you, that's called an individual plan, and your premiums, they're based on your own personal health risk. But if your employer is in the picture, that's a group plan, and believe me, that changes the whole game.
So, what's the big deal with group plans? Why are they so different? Well, it's because the insurance company isn't just looking at you anymore. Nope. They're looking at the entire group, all your coworkers, and they're calculating the average risk for everybody. That, plus the fact that it's way cheaper for them to send one bill to your company instead of hundreds of individual ones, usually means better rates for you. And on top of that, group plans come with some really important federal protection.
And speaking of protections, one of the most important ones you'll hear about is COBRA. Just think of it like a safety net. Let's say you leave your job. COBRA is the rule that lets you hang on to your health coverage for a while as long as you pay for it yourself. It's this vital bridge that can keep you and your family covered while you're transitioning to a new job. Okay, so we've got the first piece of the puzzle, who the contract is with. Now let's move on to our second key question. Who is actually providing the plan? And this brings us to another major fork in the road. Your insurance is either coming from a private company, a commercial insurer, or it's what we call social insurance, which means it's provided by a government program.
Yeah, the government is a huge player in the health insurance world. You've probably heard of some of these major programs. There's Medicaid for low-income folks and families. You've got Medicare, which is the federal program for seniors and some people with disabilities. Then there's the ACA Marketplace, where individuals and small businesses can shop for plans. And of course, there's TRICARE for our military members and their families.
Let's zoom in on TRICARE for a second, just as an example. Even inside this one government program, you have options. You could use military hospitals as your main source of care. Or you could pick a PPO that's a preferred provider option, which gives you a network of doctors to choose from and saves you money. Or you could go with a more traditional fee-for-service model, where you basically pay for each specific medical service as you get it.
All right, we're on to our final question. And honestly, this might be the most important one of all. When you actually get sick or need care and have to use your insurance, what's actually covered?
So, the key word you really want to listen for here is comprehensive. A comprehensive plan is something called an open peril policy. Now, I know that sounds super technical, but the idea behind it is actually really simple, and it's incredibly important to grasp.
Here's the deal with a comprehensive policy. Boiled down, everything is covered unless the policy specifically says it's not covered. Think about that. It's the total opposite of a limited plan, where only the things on a specific list are covered. With comprehensive, the default is yes, it's covered. If it's not on the no list, you're good to go.
And that's it. There you have it. Just 3 simple questions that give you a blueprint to understand pretty much any health insurance plan. See? You don't have to be some kind of expert. You just need to know the right questions to ask.
So let's just do a quick recap of our new toolkit. Question 1. Who is the contract with? Is it individual or group? Question 2. Who's providing the plan? Private company or the government? And question 3. How much is covered? Is it comprehensive or limited? That simple framework, that's all you need to start analyzing any health plan.
So now the ball's in your court. I want you to take a look at your own health plan. Can you answer those 3 questions? Because really, understanding your plan is the absolute first step to taking control of your health. Thanks so much for joining us for this explainer.